welcome to Mystical Insights. My name is Patricia Richardson, and tonight's guest is a fabulous doctor. His name is Dr. David Ackerman, and he's a chiropractor. David, welcome to the show.
Thank you, Patricia.
Oh, it's such a pleasure to have you. You do a number of things, and you've been around the field for many years now, haven't you?
Yeah, I've been a chiropractor and acupuncturist since 1979.
Wow, that's a long time.
Using holistic procedures like herbs and applied kinesiology and homeopathy. Neuroemotional technique was developed by Dr. Scott Walker, and he combined principles from chiropractic, acupuncture, and applied kinesiology or muscle testing.
So he kind of put it all together.
Right.
So how do you do it, and what does it do?
Well,
in a nutshell.
Neuroemotional technique helps to release emotional blocks that are stored in the body.
Right.
Very often, when something traumatic happens to us, even though we get over it on the conscious level, the memory is stored in the subconscious and in the body's tissues. There's a cellular memory. And scientists have discovered this existing on a molecular level as neuropeptides.
And what are those?
Neuropeptides are proteins that are found not just in the blood, but the lymphatic tissues and other bodily fluids that contain these memories of old traumas.
So in my thighs and in my arms, I hold memory of traumas, that like car accidents or even birth or something like that?
That's right. There's both cellular and tissue memory of those traumas. And when an event occurs in present time, the subconscious will search back through its memory banks for when a similar feeling event occurred. So very often we're not spontaneous in life because we're always reacting out of our past. And neuroemotional technique is a way to clear out old traumas that get triggered by current events so that we can respond spontaneously instead of just reliving our past traumas.
In the second segment of the show, he'll be working on someone on the table, and so you'll be able to watch him do this technique. They
Once
haven't been
we
able
release
to get
that
to it.
with the technique, it won't be re-triggered. Next element would be wood, which is the liver or the gallbladder. And the liver, the emotion associated with that is anger.
Right.
So if anger is repressed, it can cause congestion in the liver.
Right.
See, emotions themselves aren't bad. We're all supposed to have emotions, and it's like the word emote, it's supposed to move through you.
Right.
And the problem occurs when the emotion gets stuck in the body or repressed, and that's when it affects the meridians and the organs themselves.
Okay.
Sometimes I'll have a patient who has a long history since childhood of illness.
Right.
They've been judged as a hypochondriac.
Right.
They have one illness after another.
Yeah.
You'll use this technique and muscle test them and have them say, I'm okay with being healthy, and they're not congruent with being healthy.
So their arm drops down.
Right.
Okay.
The weakness occurs, and you do this technique and you take it back and you find out they were one of 8 children, and they were one of the younger children, and the only way they ever got any attention as children was when they were sick.
Right.
And then they get mom's attention.
Yes.
And so that's in the subconscious, and they're throughout their adult life, even though it's no longer working for them, they still create illness thinking that's how they're going to get attention.
Wow.
So with a businessman who was having trouble, we might just start out, I'm okay with being successful. And then what we would find is a time that this occurred, and then we'd go back to the earliest time in his life that the issue of being successful didn't work out. It may have been in school or something like that.
So then you tap certain points on the body, and that releases it out of the body in the subconscious mind.
Right. We want to get to the earliest time in their life where that belief started.
Great.
And then they hold the memory of the event, the traumatic event. They touch, let's say it's fear, they would touch the kidney reflex. And then they put their hand on the forehead, which is the emotional reflex point. So they have to be doing 3 things: holding the emotional reflex point, the organ that's associated with the fear, and then they need to go back, remember the situation, call it up in their cellular memory, and feel the emotion as they felt it then. So if it was fear as an 8-year-old, you have to feel it how you felt it at age 8.
And we have a person from the audience lying on the table who has never been worked on by David before. We chose someone specifically so that she can give us feedback as soon as he's finished working with her. And I'm just going to go ahead, David, and turn it over to you. You're on. Go ahead and start your process.
We have a volunteer here, Karen, and
Karen Chenoweth, who will be on the show, by the way, probably next month.
When I'm touching the different reflex points on Karen, they'll be from this chart, and those are the different organs that we were talking about earlier in the show.
Okay.
That's okay.
Yeah.
And then when it comes time to do the treatment portion of the technique, we'll be using something called an activator, and this is a particular kind of activator that has a dual tip on it, and it contacts on either side of the vertebrae, and it makes a little noise like that.
And it moves bones. I love those.
So Karen, is there a joint in your body or a chronic ache or a physical problem that you have?
Yes, there is, Dave. Since I was about 20, I've had problems with my left hip due to a very severe injury that I had at that time. And in fact, I do have an artificial hip now, and so I've dealt with chronic pain since that time.
Wow.
Okay. And which hip is it?
It's my left hip.
Okay. So let's have you put this arm up. And the applied kinesiology part of the technique, or the muscle testing, is not about me overpowering her muscle, but getting to a deadlock. So I want you to gently push back that way. Okay, and when we're both pushing steady like this, there's an equal resistance. And the first thing that's done is we check a point that's for polarity.
What does
and
that
when
mean?
you touch this point, it will weaken. And that's what we want, and that shows that she is polar and that the muscle testing is going to work properly. So give me a little more resistance.
What does polar mean, David?
When we're doing the muscle testing, we're looking for a change in strength of the muscle.
Okay.
And when you touch certain points, it should go weak.
Oh,
and if the person's system needs to be cleared, either because they have allergies or there's something toxic in the body, then you may need to clear that out first to make sure that the testing will work properly.
Okay.
And so I was just checking that on her, and she's fine.
Oh, good. Thanks.
So if I come over and touch her left hip, then the arm does in fact weaken. And what I need you to do now, Karen, is with your other hand touch your forehead. Okay, and whereas before when I touched the left hand, the left hip, the arm was weak, now when she's touching her forehead, it's strong. Let go of your forehead, and then it's weak again. Touch your forehead again, and it's strong. So on the forehead are 2 points called emotional reflex points. And so the body is saying there's a problem in the hip, and then when she touches her forehead and it strengthens, that tells us that there is an emotional component to this problem. Now we know that there's obviously also a physical component, and we're assuming that that's been dealt with and handled as much as can be done. And so we're moving on to dealing with the emotional component. So now that we've established that there is some partial emotional component to this hip pain, you can let go. And we will begin the technique. So what I will do first is see if there's an age that's associated with the trauma. So we'll start with your current age. How old are you, Karen?
I'm 45.
Okay. So put the arm down, and we semantically challenge 40 to 45, 40 to 45, 30 to 40, 30 to 40. So our arm strength changed there. 30 to 35, 36, 36. Okay, so we've established that there was some traumatic event at age 36. Now I'm going to ask if that event was from any of 3 categories. In neuroemotional technique, the 3 categories are money, love, and self. So money refers to job, career, finances, all those material things. Love refers to family or friends. That's actually all of one's human relationships. So It could be your current family or your family of origin, friends, whether that be romantic or platonic. And the third category, self, or you, is any self-identity, a role that you play. So in Karen's case, that could be self as mother, self as daughter, self as sister, self as employee, self as employer, self as child of God, whatever. So we're at age 36, and I'm simply going to ask the body, is this money, love, or self, you? And so it weakened on love. So is that family, or friends? And it weakened on friends. Male friends, or female friends? Female friends. Close friend or acquaintance? Weakened on close friend. So now, Karen, I need your help. I need you to give me the first names of any female friends, and it could be any acquaintance that wasn't a relative, that were in your life when you were 36. So that would be 9 years ago, so that would be 1987. So where were you and what were you doing in 1987? Who were your friends?
In 1987, I was actually about to go through a divorce, so that was a very difficult time for me. And one of my really close friends that I spent a lot of time with, Sally was her name. I haven't seen Sally in quite a long time.
Okay, so push back with the arm. Is it Sally? Is it Sally? Okay. And was there anyone else that popped in your head? It looks like Sally's the right one, but...
Not as far as a female friend. She would have been the one that I spent a lot of time. We were both going through the same situation, and so we spent a lot of time talking about our separations and difficulties that we were having. Yes.
Okay. Was there perhaps another woman that your husband was involved with? Was it the other woman? Was it the other woman?
Not that I'm aware of.
Okay, her arm weakens with Sally, so that's the one we're going to work with. So now we have to get the third piece. We have the time of the event, who it's with, and now we want to get the emotion. So just say Sally. Sally?
Sally.
And whenever she says Sally, her arm will go weak. Okay, so I'll repeat it for you so you can put the mic down. Okay. And I'll touch each of those reflex points. Sally, 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 Sally. Sally, Sally. So right here, liver, when we touch over the liver, Sally is now strong, where Sally over anywhere else is weak. So that could be anger, or resentment, anger. So is this Sally's anger, or Karen's anger? Okay, so what we've got it narrowed down to, because it could have been Sally's or your anger, is that at this time, you can let your arm down for a second. Wow. So at this time, Karen, you had anger and in relation to Sally. So the question is, were you angry at Sally, or was it just the anger you had because you were both going through a divorce?
What I feel is that it was not anger necessarily towards Sally, but the fact that there was a lot of anger that I was experiencing at that time, and we would get together and probably have some anger sessions.
Yeah, you would share your anger.
I can relate to that.
Share our anger.
Possibly do some male bashing too, right? Okay.
Possibly.
Okay. So now we have all the information we need, but we want to find if there was an earlier time in Karen's life in which she had anger in a similar way. So we're going to ask, just push back, and we're going to ask the body that. Was there an original time in which there was a similar anger that Karen had? And we want to find the most original time. So that could have been conception to birth, birth to age 5, 6 to 10, 10 to 20. Okay, so we have 10 to 20. We narrow it down. 10 to 15, age 16, 17, 18, 19, 20. So at age 18, her arm weakened. And we want to see if it has to do with money, love, or you. So is this money, job, career, finances, love, or you, self? Once again, we have the category of love. That could be family, or friends. Male friend, or female friend. Okay, so male friend when you were 18. So you can let your arm down. We go back to the same question. Did you have a boyfriend when you were 18?
Yes, I did have a boyfriend when I was 18.
I can hear it.
And what was his first name?
I'm embarrassed to say I can't remember his first name.
Well, the good thing about this technique, as long as she thinks about him and she can picture him in her mind, we'll get the same response with the muscle test. So.
But I know exactly what I was angry about. So.
Okay, well, don't get ahead of me. Okay. So think about this gentleman.
That dirty
and
rat.
push back that way. Okay. And when she thinks about him, it's weak. So now let's find the emotion. Just keep thinking of him.
Okay.
Just keep thinking of him. And so here I'm not repeating the name, or she's not saying the emotion, because she's just, that guy. We would say that guy, that guy, that guy, that guy, that guy. Okay, and what often happens is we came back to the same organ, liver, anger, resentment. So it could be resentment, but no, it's anger. Okay, so now go ahead and tell us the story. This is the part she's been waiting
Okay,
about.
I need to intervene for just a moment and let you know that we've got maybe 1 or 2 minutes of this segment of the show.
Okay.
Okay.
So what we'll do is have you sit up and face that way, Karen. Okay. And what we need you to do is you can begin telling the story, and at the same time place this hand over your liver. Okay, and that'll represent the anger. Go ahead and briefly tell us what it's about.
Well, real briefly, I was a year older than this, we'll call him gentleman at the time, and I really liked him a lot. And after I graduated and got into college at that time, I wanted to keep seeing him, but his mother thought I was an older woman and should not have a thing to do with him. Wow. So I was quite upset about it because I really liked him a lot.
What we need to do now is remove that trauma. So put the mic down and touch your forehead. That's the emotional reflex. She has the liver. Do you remember your anger about being thought of as the older? Right there, the liver, yes. Okay, so you're the older woman. Feel the anger as you felt it then. And I'm going to use the activator. Hold that thought and feeling. Feel the anger at age 18. Now breathe in and breathe out. Breathe in and out. One more, breathe in and out. Okay, now you can let go of those 2 spots and lie on your back again.
Well, I've been activated. Ouch!
So
I
that
have.
cleared the anger out of that neuroemotional complex, or NEC. Turn your head to your left, Karen, and push back. Push back. Are there any other emotions associated with that? Okay, the arm's staying strong. Sometimes what we'd find is there may have been fear or grief over losing this man. In this case, it was just the anger, and there are no other emotions associated with the event. So let's go back to the hip and touch the hip now. Okay, and previously when she touched the hip, the arm would go weak, and now it's very strong.
Great.
And so that shows that this is all tied in to the hip.
Wow.
And all that anger and memory was triggering some of the recurring hip pain.
All right.
Okay, you can let your arm down, Karen.
Well, thank you so much. That was very impressive. So, at this time, we'll go ahead and go to the audience. And Karen, we'd like for you to go ahead and stand up and tell us what you experienced with your healing from Dr. Ackerman.
Well, that was wonderful, David. I'd like to thank you very much. I was very interested and amazed by how asking those simple questions, which had an emotional component, would immediately weaken or strengthen a muscle in my arm and the relationship to my hip. And what I'm very impressed with is the fact that I have known for a long time since I had my accident that there would be something emotional that would trigger pain in my hip, and it was nothing physical that was going on. I hadn't exercised too hard or done anything to particularly strain it. So I was aware, but it's been very frustrating because I couldn't think, now what's going on here? What's happened that's triggering some kind of an emotional response in my hip? So I would like to thank you for that awareness and knowledge and clearing that out. And by the way, the young man's name was Dale, so I did remember.
Dale, that dirty rat.
Yes, Dale. So I've told Dale goodbye forever. You will not show up in my hip anymore.
Great.
So thank you very much. It's been a real delight having you work with me.
You're welcome.
My name is Judy. Dr. Ackerman, I was wondering if the body holding on to emotion, does that inhibit the healing process of the body at all?
Yes, it has an effect on the immune system and makes us more susceptible to illness. And it's that storing of the emotion that blocks in the meridian. As we were talking about earlier, if the emotion just flows through you, it moves through you like an energy, then that's its purpose. So something like anger can give you strength. But when you hold on to the anger, that's what causes the problem, or when the anger is repressed.
Okay. Do you find that your clients are open to looking at these things more and more about emotional trauma and that sort of thing?
Yes. I find several things. One, that people really enjoy this technique because it's about them. It's about their personal lives, and they get involved in their own healing process, which, after all, we're each responsible for our own healing processes. Mm-hmm. And we're also finding in this day and age, I think in the past, women were always in touch with their emotions, and I'm finding more and more men willing to work on their feelings and their emotional issues.
That's good. Thank you.
I'm Linda. Dr. Ackerman, how long has the neuro-emotional technique been available? And when did you
Dr.
first learn
Scott
it?
Walker developed the technique back around 1987. He was formulating the ideas and putting it together. So it's been around 9 years, and he's been teaching it. He's actually the only recognized teacher of the technique, but he's been working hard spreading it around, and it's gaining popularity as a chiropractic technique, as well as there's medical doctors, neurologists, psychologists, and acupuncturists also utilizing it.
Mm-hmm. So this is mainly throughout the United States, or is it also in other countries?
At this time, it's pretty much limited to the United States. He's taught some seminars overseas, but that's very limited. The last seminar I was at, there was a chiropractor from Switzerland who flew all the way from Switzerland to the United States to attend the seminar. One interesting thing that comes up sometimes when someone is in a car accident, if they have a history of abuse in their lives, being in a rear-end collision and feeling like a victim again brings up their old abuse issues.
Yes, it does.
And so very often the people who are very slow, have a delayed recovery, and don't heal as they should from these injuries, it's because the old abuse issue has been brought back into the conscious memory, and it's being acted out in their body. And a technique like this that would clear out the old abuse issue would allow the body to heal itself.